Imagine standing in a totally chaotic emergency room, right? Like opening a patient's chest for a life-saving zero margin for error surgery.
Yeah, incredibly high stakes.
Right. And then imagine stepping out of that blood-soaked room, washing up, and just walking into a quiet, sterile lab to manipulate microscopic cancer DNA. Welcome to today's deep dive.
It is
Quite the contrast.
It really is.
Today, we're exploring the profile of Dr. Sevil Ghasemi, a board-certified general surgeon in Iran, to really figure out the anatomy of a modern physician scientist. So, okay, let's unpack this, because right out of the gate, there is a mind-blowing detail. She earned her Doctor of Medicine and a Master of Public Health in the exact same year, 2018, which, I mean, that is a massive workload. But more importantly, it establishes a really unique lens for her career. The MD teaches you to, treat the single patient right there on the table.
At the micro level.
Exactly. While the MPH trains you to look at population level trends. So she isn't just fixing a single broken pipe. She's actually studying the city's entire water system, so to speak.
I like that analogy.
Yeah, and that dual micro-macro perspective, it's crucial when you look at the intense clinical environments she stepped into. And I mean, they don't get much more intense than trauma. We're talking about her leading trauma teams, doing solo emergency surgeries like ED thoracotomies, which is literally cracking open a chest right in the ER.
It's incredibly intense.
It sounds exactly like trying to fix an airplane engine mid-flight. But honestly, how does operating in that kind of high adrenaline chaos shape a medical professional's mindset? Like, does it just make them purely reactive? Well, what's fascinating here is that it actually forces the exact opposite. It forces rapid systems level organization. We saw this forged during her time as chief resident at Rasool Akram Hospital, right in the thick of the COVID-19 pandemic.
Oh, wow, 2021, 2022, just peak chaos.
Exactly. That trial by fire means she now leads these trauma teams, coordinating multi-trauma responses across different specialties. We're talking emergent tracheostomies, severe burn care. She has to triage massive amounts of data instantly, so the chaos doesn't scatter her thinking. Right, it crystallizes it. Okay, but if trauma crystallizes her thinking, her next move completely breaks the mold. Because, wait, how does a trauma surgeon even pivot to molecular cloning and PCR?
It's a huge shift.
Right, like hand stability for a scalpel makes sense, but manipulating DNA is an entirely different scientific language. Why leave the OR for the lab bench? I think it comes down to a frustration with purely reactive medicine, because in trauma, you fix the immediate damage. But to stop the damage before it starts, like in oncology, you really have to understand the cellular blueprint, which brings us to her specific oncology research. Here's where it gets really interesting. Yeah, for example, she co-authored a 2017 study looking at ghrelin,
Which is known as the hunger hormone, right?
Produced in the stomach. Right, exactly. So when you surgically remove part of the stomach to treat gastric cancer, ghrelin levels plummet. Dr. Ghasemi's research looked at why tracking that specific hormonal drop can actually predict a patient's 3-year survival rate.
Wow, so it's predictive, not just reactive.
Exactly. And similarly, in a 2019 in vitro study, she looked at aprotinin, which is a protein enzyme inhibitor. She mapped exactly how it suppresses the growth of human breast cancer cells. That's wild. She's taking the clinical problem from the surgical suite and just solving its chemical mechanism in the lab. She's bridging that gap perfectly. So she's mapping these microscopic causes, but she's also stepping way back to look at the patient's psychology, specifically with her bariatric surgery research. It's almost like tearing down a load-bearing wall in a house without checking the blueprints first.
That is a great way to put it.
Right, like if you don't prep the patient's psychological foundation, the sudden extreme physical changes of bariatric surgery can cause their whole mental structure to collapse. So what does this all mean for how she actually treats patients? Well, it means she treats the timeline, not just the procedure. Like in 2023, she published a study examining why bariatric candidates drop out before they even get to surgery.
Looking at their psychological barriers.
Yeah, exactly. And then her 2025 systematic review tracks the long-term mental health of pregnant women who previously had bariatric surgery. She specifically mapped rates of depression, anxiety, and eating disorders.
Because the surgery is just one day.
Right. But the psychological reality of living in that altered body that lasts decades, it fundamentally changes what you, as a patient, should expect from healthcare. We're looking at a bilingual professional, fluent in Persian, English, and conversational Turkish, who just seamlessly bridges trauma surgery, microscopic cancer research, and long-term patient psychology. It really shifts the paradigm. And as medicine becomes incredibly specialized, it raises an important question.
What's that?
Well, how will future technologies like artificial intelligence amplify the capabilities of hybrid physician scientists who have already mastered both the surgical suite and the cellular lab? Like, will the gap between the lab bench and the operating table eventually disappear entirely? That is the ultimate question for you to ponder today. Because when your doctor can simultaneously understand your mind, decode your cells, and fix the airplane engine mid-flight, the future of medicine looks profoundly different. Catch you on the next deep dive.